Hello and welcome to 4D 2.0. Today we'll be covering episode 37, the detailed discussion and dialogues in Indian diabetes. And today's topic is body weight, a risk factor for CVD. It's a very important topic. I think we need to be talking about body weight more often, and and the risk factor for obesity and cardiovascular disease, especially indirectly or directly linked to diabetes, is something which is epidemic in our country, and we need to focus more on this. And in order to help us navigate through this topic, we have Dr. Srikanth Hegde. Sir is from Mangalore. He has multiple degrees in diabetes, public health, hypertension, and he is a former consultant and resident of Department of Endocrinology, Father Muller's, and currently he is a consultant diabetologist in Kanchur Hospital in Mangalore. Over to you, sir, to help us navigate through this challenge that we are all facing with our patient population.
Thank you. I welcome all of you for this yet another session of 4D, which is detailed discussion and dialogue for Indian diabetics, an initiative to increase the awareness about diabetes amongst the all the healthcare providers and also general public at large. My topic for today is the increased body weight. How does the increased body weight increases the chances of developing diabetes and also cardiovascular disease? So before I start, I would like to thank Informa for giving this opportunity, and also I sincerely thank Dr. Abhijit sir for giving a nice introduction. So let's plunge into the topic. So obesity is very common, as we can see. Normally, when we go outside to the general public, in the mall or in the commercial street or in the marriage hall or in the hospital itself, we see 50% of our fellow members, they are all obese. The children's, females, everybody, they come to our cabin or the hospital, alarmingly, they are all obese. So this is increasing day by day. Obesity is, how do we define obesity? It's a very simple formula, calculate the body mass index, where we divide the weight in kilograms by the square of height in meter square. So square of height in meters. So the number what we get, the BMI, if it crosses more than 25, and also in Southeast Asian, they say 18 to 23. Internationally recognized number is 25. BMI of more than 25 is overweight category, and the BMI once it crosses 30, and definitely individual is a obese, we can say. So the obesity is it's a complex condition in which there's increased deposition of fat in the subcutaneous tissue and also in the visceral environment. So visceral adiposity. So what does it do? It increases the insulin resistance is one of the most key factor in developing all the cardiovascular disease and diabetes and many other things. The root cause of this is insulin resistance. So in urban India, we see about 3 out of 4 Indians are overweight in the people who are living in the urban area. The prevalence of abdominal obesity is alarmingly very high in women compared to the men. Even men also it's there, but in women it's about 40%. Men is, they say 12%. I personally believe it's even more than that, but the number says it's 12% in men. But the women population have more abdominal obesity. Study shows that about 5 to 6 out of 10 women between the age of 30 to 49 are abdominally obese. The association of abdominal obesity in women is stronger with the older age group, urban residents, wealthier sections, and non-vegetarian food lifestyle. And also nowadays, practically what we see, even economic status and people coming from the rural areas also becoming more and more obese because of the increased sedentary lifestyle even there. So Indians are at increased risk of, at biological risk of developing coronary artery disease or cardiovascular disease. So because of the complex interplay of the environment and the genetic and the epigenetic factors, the stress, the environmental factor, the tropical nature, the food what we consume, and the physical activity and the economy, the increasing economic region, which so people are becoming more and more affluent and more sedentary. So as the obesity is increasing, so the cardiovascular disease incidence is also increasing. It is not only in the Indians living in India. So the number is, the Indians living in India is about 20.4% for having diabetes and about 11% those non-diabetics. So the number is literally half of the compared to the people who are having diabetes. But this is not only true in Indians living in India, but also we see the same trend in those Indians who are living in abroad, non-resident Indians, compared to their other ethnic groups. the Indians subcontinent, the region from the person from the Indian subcontinent are at the increased risk of developing cardiovascular disease and diabetes compared to the BMI to the other population. So the prevalence of cardiovascular disease in rural area is definitely lesser than the urban area, because still the lifestyle in the urban area is slightly challenging. Lifestyle is into a lot of physical activity, and also the food consumption pattern is also relatively healthier than the people living in the urban areas. So that's about the obesity, the picture of obesity in India. But what about the picture of diabetes in India? In India, we have about 77 million people above the age of 18 years are suffering from it. So type 2 diabetes. So very Indian Council of Medical Research India Diabetes Study. I studied from the same institution where it was the one the first phase was released. I was there for the press conference. This study gives a full picture of the whole country. The study was conducted in 3 separate phases, including 31 states and union territories. So it clearly showed the highest number of diabetic individuals. So as we all know, the India is a capital. It's a diabetes capital of the world. Although also we have a large number of pre-diabetics, as well as we have diabetics, we have a large number of pre-diabetics. So adults with the diabetes, those with type 2 diabetes, a small group of other type of diabetes, they have about 2 to 3 fold increased risk of developing heart attacks and cardiovascular disease and stroke. So this is a very alarming state. See, this is one of the study which is published, a UK biobank cohort study, uh, to know the relationship between the diabetes, obesity, and cardiovascular disease. So it clearly showed that the additive effect of diabetes and obesity on the cardiovascular disease outcome. Now, how does obesity and diabetes causes the cardiovascular disease? If you can see the picture on the left side, the increased adiposity releases the adipokinins, which increases inflammation. So the inflammation is one of the root cause for insulin resistance. So once there is insulin resistance, there is a defect in the translation pathway and defective protein production. And also the increased adiposity causes more afflux of these free fatty acids to the blood, and also this accumulation of this lipid derivatives causes lipotoxicity. That also causes the same problem. And aggravating to this condition, the people are becoming more and more sedentary. People are consuming more and more high calorie diet. People are becoming more and more, aging. So these factors are aggravating the ongoing condition, because that leads to development of cardiovascular disease. And how does the diabetes causes cardiovascular disease? The insulin resistance is the root cause, as we defined earlier. The hyperinsulinemia, basically the hyperinsulinemia increases the MEP kinase, which is mitogen activated protein kinase, causes accelerated atherosclerosis, which leads to cardiovascular disease, and also impaired PI3 kinase signaling, leading to impaired muscle glucose uptake and impaired suppression of glucose production, leading to development of type 2 diabetes, and that causes increased risk of cardiovascular disease. So the important thing is, how do we prevent this? Prevention is always better than cure. So prevent obesity by limiting unhealthy food, increasing the physical activity, limiting the television time, screen time, improving the sleep, and reducing the stress. How do we prevent the type 2 diabetes? It is all remains the same. All the modalities of prevention remain the same. Lifestyle changes, healthy, reach the healthy body weight uh, category, stay physically active, at least 30 minutes of moderate activity, healthy diet, and avoid tobacco smoking. Of course, not directly related, but yes, it all leads to cardiovascular disease. And the third one is cardiovascular disease itself. So again, the modalities remains the same: eating healthy, controlling your blood pressure, controlling your blood cholesterol, controlling your diabetes, increasing physical activity. The same thing which prevents all the conditions, and in the end, the final effort of ours is to prevent the cardiovascular disease, which will lead to improved cardiovascular outcome. So there are therapeutic strategies available for weight loss, but not very effective per se. So for a short-term use, phentermine and diethylpropanone is used. For approved long-term use, orlistat causes the decrease fat absorption from the gut, and phentermine and topiramate decreases the appetite, improves the satiety, and other things like liraglutide, semaglutide belongs to incretin-based therapy. They have a wide variety of action, and eventually they leads to weight loss and also improvement in type 2 diabetes. And also we have newer category of medicine. It's not very new anymore. SGLT2 inhibitors, they are very effective in improving body weight and also blood sugar and also blood pressure, thereby improving the cardiovascular outcome. So according to the AHA, ACC, and HFSA, the guidelines, the SGLT2 inhibitors, the initiation of SGLT2 inhibitors effectively improves the heart failure with the preserved ejection fraction, and also improves the oxidative stress, improves the inflammation, fibrosis, and also myofilament stiffness compared with the patient who is not using the SGLT2 inhibitors. So commonly we also see in our practice people even before coming to us consulting cardiovascular disease, the cardiologists, they have initiated the SGLT2 inhibitors. Even the nephrologist also uses the SGLT2 inhibitors, widely used. So because of the lot of beneficial effect of this particular molecule. So evidence-based study. So the fixed combination of sitagliptin and dapagliflozin showed at a 24 weeks international multicenter randomized double-blind parallel group placebo-controlled study, phase 3B study in the stage phase 3 showed the improved diabetes outcome and improved BP or blood pressure outcome and also body weight outcome from the baseline over 24 and 8 weeks respectively with the dapagliflozin. So fixed phase combination makes a lot of sense because they have a lot of beneficial effects. So when we fix the molecule, what happens? There are multiple benefits. They combine together and gives the more favorable outcome. So the patient improves the insulin resistance, improve the beta cell function, and patient becomes more compliant with the therapy because of the less pill burden. Only one pill will do all the wonders. So the adherence is better, compliance is better, and cost is better because it works out really well for the patient. And also it aids in reduction of body weight, aids in reduction of blood pressure. So all win and win situation makes this particular combination very good combination for our clinical practice. So this was about a small presentation about the body weight, diabetes, and the cardiovascular disease outcome, and how we can prevent all these things using our lifestyle changes and also our molecules which in our hand. So with this, I think I end the session, and we can discuss some of the points discussed in this particular presentation. I thank you.
Thank you so much, Shrikant sir. It was very, very clear and well laid out risk factors that all of us as practicing doctors need to be looking at.
Yes.
So, few points that I think most of us, whether we are working in the city or working in rural areas, I think all of us
Yes.
are seeing more and more of our patient population ending up, not being at the optimum weight. I think it is important right from childhood that we need to start our practices with regard to health and body weight. It should be, inbuilt as part of what we do as from school children onwards, because once we become adults, then again life will become totally different. So my first question, sir, how often or how common are you seeing this challenge of obesity in your practice, and where do you feel we are falling short when we are dealing with such kind of a challenge?
Obesity is very, very common, sir. You said it's children's getting obesity, and also we see a lot of our into our patients, having obesity. So we see practice. I cannot give you the exact numbers, but I would definitely say about 60 to 65, 50 to 60% of my patients are obese, and my entire effort is reduction of cardiovascular risk. The first and the foremost, my goal is to reduce the body weight. So if you can take care of the body weight, so rest everything will take care by itself. Now we see, you said, rightly said, the children's the developing diabetes, sorry, obesity, right from the childhood. Now it's very common because the lifestyle of the see, it's there are two, probably the two factors are playing, the genetic factors and also the epigenetic factors. But I would say the epigenetic factor is more important here than the genetic factors, because the child who, it's all nuclear family picture, working parents, they have a very urban lifestyle, and so the children's are only one or two children's. So the children's are their screen time is increasing. And the calorie intake, the nutrition of the diet is going down, the calorie intake of the diet is going up, and the physical activity. So we all live in the very urban environment. The chance of child, unless they actively participate in any sports group or something, the children don't go out, so they develop obesity. Once they develop obesity, they almost remain obese even during their adulthood. And I think we can address that by increasing the primordial prevention, by increasing the awareness about this obesity, what it leads to obesity right from the school days. Then thereby we can prevent the obesity in the adulthood, and that thereby we can prevent the cardiovascular disease.
Very true, sir. I think now the biggest again challenge in a clinical setting for us to manage patients, I think the seriousness of what they are dealing with is one, it is not fully established. They feel that it's okay to this much little bit of visceral fat, it's okay. But from that
Right.
point, it leads to the next point because the level of inactivity, the level of stress, their own epigenetics, as you mentioned, all of
Yes.
these are playing a part, and over time, if they are not proactive, it is going to make a big impact on I think the country's health, because in the end of the day, the more we are having a population who is sick, the weaker a country is going to get economically, as well as from a functioning standpoint. So for us, I think
Fully agree.
a happy population and prosperous country, health is should be made more prioritized. If I look at the non-communicable diseases, the charts, from probably 20 years back and now, what you look, from communicable disease, the non-communicable disease has gone skyrocket. And whether it
Yes.
is hypertension, obesity, diabetes, we all as doctors have to be very, very proactive in management. So when
Yes.
it comes to uh, what are the best practices, how do you want to put a point across, what have you found challenges, as well as what have you found something that has worked for you when you're counseling your patient, for them to lose weight. So what have you found, sir, that works for you in your practice? Because again, if you look at the average time we spend with the patient in throughout the country, it is anywhere between 5 to 10 minutes. So how can you add some points on day to day management when you're telling a patient to lose weight, sir?
Yes, sir. Basically, uh, right from the beginning, from the word go, from the first visit, index visit, I tell them what is our target and what we are trying to achieve here. So I usually I take little time to assess their background status, what sort of lifestyle they go through, and all those things. Then I assess the risk of what is the risk of developing cardiovascular disease. And obviously the body weight is a subject here, and rightly so. The body weight is invariably, it will be higher. So I tell them, you see, I don't see, there are people who are on very, on the medications which causes very weight gain, sulfonylureas, insulin. So what they come, their diabetes is fairly under good control. But still, I would tell them that we have a newer generation medicines are available. We have a 5G network available. Why do you want to stick to the 2G network? Even though it does the job, but it does it in a better way. It has got a lot of benefits. Weight loss. I explain them what is the benefit of weight loss. How does it improve the life? I don't know whether I should be saying this or not. Sometimes I say to the patient that, if you control your diabetes really well, it can extend your lifespan up to 10 years. So that is the advantage you're going to get when you do the things correctly. So I selectively choose the newer molecules such as DPP4 inhibitors and SGLT2 inhibitors and all the GLP-1 analogs. I use them a lot because patient deserves it. Even the patient are not, see, we don't get time. Patient not in a patient not in a very patient mood to hear all those things, but still it's our job to explain to the patient the benefit of these molecules and how does it improves the cardiovascular outcome in the future. So we should spend time to explaining out to patient what is the benefit of this, doing all these things correctly, ticking all the boxes will improve their life, life after 10 years, after 20 years. This is what I'm going to give the picture to the patient right from the beginning. So they sort of accustomed to my style of practice. They know, we are planning for next 20 or 30 years ahead. So I just tell the patient, we are not, we are not controlling your diabetes. Diabetes will control by itself. We only control your risk factors and do the right things properly and with the proper combination of medications. Think everything will be okay, and your quality of life will improve, and everything will improve. This is what I try to explain to the patient, and it works really well. Adherence is good, and I try to keep my prescriptions very minimal, as minimum as possible. I tried. So I was never a good. I have to be very frank with you. I was never a good big fan of combination therapy. But after this gliptins and the gliflozins and our metformin, so I've become a big fan of this, and I'm using a lot. So it's giving a very wonderful result. So I think
Well,
this is what give me a little bit
yes.
sense of satisfaction, and giving good
So,
results as well.
yes, I think what Shrikant sir is trying to tell us all is, use the right combination of medicines,
Yes.
explain the risk factors to the patient correctly, uh, paint the right picture to the patient rather than scaring the patient. Paint the correct picture. This is what we can do to you. This is how
Yeah.
your improvement. So motivating the patient is an important point. And I think, and he also mentioned, simplifying the prescription, not to make it too complex as well. So these are, I think, some of his best practices that he follows in his clinic. And the one final question, sir, I think for all of us, it is important point. So, what is your motivating factor that you'd like to tell your patients? So, see, when they're dealing with disease, sometimes we tend to take it for granted. Okay, you have diabetes, but sometimes patient doesn't understand the seriousness nature of the obesity or diabetes. So what would you, on a lighter note, like to tell the patient on like a motivation, to keep them consistent with their lifestyle, to keep them consistent to take the right combination of medicines? How would you want to, how do you do it in your practice?
Uh, I try to be very practical with my patients, sir. But since I said earlier, I tell the patient why it is important to do all these things, all these drills regularly on a monthly basis or a 3 monthly basis, because it gives you a very good, returns. It's like a good investment what you do and gives a good result. Only when you have this healthy, complication-free, prolonged lifestyle, you can enjoy the good quality of life. So this is the only way you can do it. And sometimes, as you rightly said, the people who with the long-standing conditions, consuming a lot of tablets for a long period of time, if sometimes we have to think from their point of view. Now we only think from our point of view. Now we prescribe medication, patient doesn't come for a review, but a lot of things goes on in behind it, because their economic factors, their work pressure, their family stress, all those things will be going on. So we try and spend time and explain to the patient that why it's important to do it. Sometimes, a lot of people will drop out just like that. They drop out. They beautifully they comes to our care, and from bad diabetes to a good diabetes, they'll become a very good patients, and suddenly they disappear. So all those things happens when they come back. I think, again, we should not get frustrated and explain to them then why it is very important to stick to the plan of action. So the only motivation why I give them is they have to do it for it's their duty to give the body a right an environment to do the right thing. So when you don't take care of their diabetes, the body will suffer, and the body will suffer and leads to all the complications. So to prevent that, doing this will only gives a lot of returns to their family and for themselves. That's why this is what I tell our patients, ask them to come for a follow-up regularly, and uh, yes, control diabetes and obesity very well. This is what I do.
So thank you so much, sir. It was a nice and wonderful presentation. I'm sure all of us watching today will learn a lot and be more proactive with our patients, especially when it comes to obesity management. Not just look at diabetes from a single angle. You need to tackle diabetes from a multi-prong approach, and lifestyle is the basis of all treatments when it comes to any communicable disease. So thank you one
Yes.
and all for today, for tuning in today, and see you in the future episodes. Thank you.
Thank you, sir. Thanks for this opportunity. Thank you.